are live.
Hey everyone, it's Ryan over here at KMC Dermatology and Med Spa, and we're here today with the world-renowned, Harvard-trained hair transplant expert, Dr. Meena Singh, and she's going to be taking your questions and talking just a little bit about hair loss and, you know, kind of the stuff that she does. So I'm going to kind of give it to you, Dr. Singh. Tell us a little bit about yourself and, you know, how did you get into dermatology and how did you get into specializing in hair-related conditions?
Thank you for asking. So yes, how I got into hair, well, I started off with dermatology. So when I was in medical school, I was very interested actually in orthopedic surgery, but I learned more about it and I happened to be doing a fellowship and doing research in orthopedics, and I had some time to write up some papers. So I helped someone write up some papers in dermatology, and their principal investigator encouraged me to seek it out and do some rotations and figure out if it was something I was interested in, since I was already published in some major journals in dermatology. So I pursued a couple rotations while I was in medical school, and then I found that dermatology was completely different than what I expected. I thought dermatology was just, you know, acne and rashes and warts and things that we really didn't talk about in medical school, and it wasn't something that was, you know, covered really well in medical school. And I learned that it was a surgical field. It was almost like a general practice field. You can do pathology, you can do pediatrics. It was a very wide range field where you can really pursue whatever aspect of it that you would like, and that it had really good freedom to kind of arrange how you want to practice. So if you want to do only surgery, or if you want to see a mix of maybe cosmetics and surgery, general patients, pediatrics, you can do all those things. So while I was in my training, after I finished medical school, I obviously then matched in dermatology, and I realized that hair loss was one of the main reasons that people in general sought out dermatologic care. And it was something that I felt that people really suffer from, and there are certain groups that suffer even more from it, and I just gained a passion for it. And so I applied for a Women's Dermatologic Society mentorship program, and I was able to do it with my amazing mentor, Dr. Marc Avram, who is in New York City, who is also just well-renowned and one of the gurus in hair transplant. And so I was really very lucky and honored to train under him. And after I did that mentorship program and got that award, then I realized that was going to be my passion, and I then pursued an international Society of Hair Restoration Surgery fellowship with Dr. Avram, which I did for a whole year, which is really nice because that fellowship is really hard to get into and it's very limited. There are very few positions worldwide for that fellowship, and for me to be able to pursue that for an entire year where we focus purely on hair and surgical aspects of hair treatments and therapies, I was really able to kind of hone my skills with that. We did a ton of hair transplants that year. We did a lot of research. We were really on the forefront with robotic surgery during that time. So yeah, that's how I got into hair transplant. And it's very nice because it's a really rewarding field. Hair is very difficult. Hair loss is very difficult because many times there are systemic causes, there are other causes that may not be as obvious, and often folks that don't necessarily specialize in hair loss don't have the time to go into detail with the causes for the hair loss. So it's nice to specialize solely in that, where we can kind of hone in on the causes and really focus in on how we can decrease the further hair loss and see if we can get more hair to regrow in. And if we can't, we can always do hair transplant, where we add hair where it can't grow back.
Sure.